Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see another new topic, that is Alzheimer's disease. So Alzheimer's disease, all things we have learnt already, but and we are also doing to the day-to-day life. For example, if I am asking you to take the notes and you need to submit your notes onto tomorrow, what you guys will be telling, sir, I have forgot the note, sir, I have forgot to write, and all these things are common onto the college and the school level. But so this is not Alzheimer's, and this is completely an Alzheimer's, which will be affecting for the adult stage. Now going for the slides, first understanding the Alzheimer's. We need to understand what thing which is happening inside the brain and also to the brain cavity. Now, global perspectives. Millions of peoples along the globe will be affected with the Alzheimer's. So it is a leading causes of the dementia. So dementia, what is dementia? So dementia is the initial stage of the Alzheimer's. So what is dementia? Like if I am taking a remote, yeah, I am having a remote in my hand. So if I am keeping it in my hand and within 5 to 10 seconds, 5 to 10 minutes, I am forgetting where is the remote which I have kept. So if I am keeping here, so I will be searching onto the some other area. So these are the initial stages of the dementia. Now, so this dementia will be provoking the Alzheimer's disease. Indian scenario. Now coming for our scenario. So it is a rising burden. Awareness and infrastructures are growing. Early diagnosis is crucial for better outcomes. Why our Indian culture is the topmost in the Alzheimer's disease? I'll tell a reason. Because onto the day-to-day life in our Indian scenario, we are facing many types of stress factors, and this will be leading for the Alzheimer's. Now going for the next slide. So next slide will be going for the pathophysiology of the Alzheimer's. Simple thing you need to understand is the beta amyloid and tau. So these are the basic and the most important things which causes the Alzheimer's. And beta amyloid plaques, abnormal protein clumps accumulate. Okay, so protein are good for health, but these abnormal proteins. So these are abnormal proteins. So these proteins will be entering into the surface of the brain and it will be accumulating, and these plaques will disrupt the brain cell communication. Axons will be the most important thing, will be communicating the signals from one axon to another axon throughout the brain, and this will be causing the abrasion. Tau neurofibrillary tangles. It is a new term. Tau neurofibrillary tangles. Tangles. So tangles are like things. So we have seen tangled animation movie. Same like that. This tangles is also causing a fibers, and this tau proteins become hyperphosphorylated, and this will be causing the Alzheimer's for the last stage. Okay, now going for the next thing, and next slide will be going for the clinical presentation, that is how cognitive and other things are getting affected. Cognitive, behavior and functional aspect. Memory loss is the most important thing and the foremost thing in the Alzheimer's. Behavioral changes. So this memory loss will be provoking the people going for the mood swings. So they will be thinking of why I am doing like this, and all these things will be provoking them. Functional impairment, that is the day-to-day life activities, will be going for the struggles. Going for the next slide, that is the diagnostic. Clinical assessment, biomarker analysis, and this is going for the advanced level, biomarker analysis, okay, and neuroimaging. Okay, clinical assessment, while we can do the clinical assessment, already we have learned the cognitive physiotherapy assessment. Based on to that roles and scales, we can assess this. Biomarker analysis, this is CSF analysis. CSF will be taken from the lumbar area, lumbar puncture, and it is going for the two types of findings, and they will provoke this one. And neuroimaging, absolutely MRI, okay, and PET scans. Now going for the next one, that is the differential diagnosis. Differential diagnosis, that is vascular dementia. Maybe we might have think that this is Alzheimer's or not. So we can able to differentiate also, either it will be a dementia or a Alzheimer's. Lewy body dementia, frontotemporal dementia, and the stepwise decline in stroke history, and hallucinations, fluctuating cognition, early personality changes, language issues. And all these things are the initial stages for the development of the Alzheimer's. Now going for the last one, that is the pharmacological. That is simple, that is the drug analysis. That is choline esterase inhibitors. These are the drugs, and you need to make it noted down in your notebooks. And NMDA receptors and cognitive stimulation drugs, which are helpful for the maintenance of the memory loss, lifestyle modification. And these are about the Alzheimer's disease. I hope this video will be helpful, and this class will be helpful for you also. Thank you.